Good morning, everybody. This is Kat Chin, Board President of the Oregon Board of Pharmacy. I will now call this meeting of the Oregon Board of Pharmacy to order. Today is Friday, June 13, 2025, and it is now 8:30 a.m. Board of Pharmacy meetings are conducted in accordance with the Oregon Public Meetings Law. Under the Public Meetings Law, the governing body meetings are open to the public except as otherwise provided by law. The presiding officer has the authority to keep order and to impose any reasonable restrictions necessary for the efficient and orderly conduct of a meeting. Governing bodies are authorized by ORS 192.660 to meet in executive session in certain limited situations, including the consideration of information obtained by a healthcare regulatory board as part of an investigation of licensee or applicant conduct. All official actions by the board must be taken by public vote, and the vote of each member must be recorded. Mission: the Oregon Board of Pharmacy serves to promote and protect public health, safety, and welfare by ensuring high standards in the practice of pharmacy and through effective regulation of the manufacture and distribution of drugs. In addition, the Oregon Board of Pharmacy is committed to diversity, equity, inclusion, and belonging, DEIB, within its organization and for the public it serves. This commitment is reflected in board membership, agency staffing, the services provided, and its efforts to promote patient safety and ensure access to quality pharmacy care. The board encourages review of its full 2024-2026 DEIB plan located on the board website. I will now call roll for board and staff. For the record, when I call your name, please verbally acknowledge here. Board President Kat Chin here. Board Vice President Rich Joyce. Here. Board Member Shannon Beeman. Here. Board Member Jennifer Hall. Here. Board Member Amy Kirkbride. Here. Board Member Victoria Kruger. Here. Board Member Priya Patel. Here. Board Member Anna Pinedo. Here. Board Chief Compliance Officer Joe Ball. Here. Compliance Director Brian Eckermann. Here. Licensing Director Chrissy Hennigan. Operations Manager Rachel Melvin. Here. Executive Director Gary Runyon. Here. And Board Counsel Angela Hunt. Here. Thank you. Public comments will occur today towards the end of the meeting. The board will not deliberate any issues or requests during public comment, such as formal requests, issues currently under investigation, requests pending before the board, or currently proposed rules. Public comment is limited to matters that were noticed on the board meeting agenda, and comments will not be allowed that are longer than the time allotted by the chair. To sign up to provide public comment, sign up at the door or email your request to pharmacy.board@bop.oregon.gov by noon today. Housekeeping. Board and agency staff, identify yourself as board or agency staff member, last name each time you speak. Speak one at a time, raise your hand, and when you have questions or comments, and silence all devices. Please note that this meeting is being recorded and retained for public record keeping purposes. The board will meet in executive session later this morning after receiving a presentation from Board Member Patel. We will break for lunch between 12 and 1 and anticipate resuming open session between 1 and 1:30 p.m. We'll now begin our annual board business meeting, starting with Executive Director Runyon.
Good morning, everybody. Executive Director Runyon. And the first thing we'll talk about is a little further up, is an update on board and PFAC appointments. I'll start with the board. Number one, Brian Smith, PharmD MBA out of Milwaukee, Oregon, staff pharmacist with specialty medical staffing. He was confirmed by the Senate and appointed to the board for a 4-year term starting July 1st, 2025, ending June 30th, 2029. We look forward to onboarding the new board member in July, and he's looking forward to meeting the board at the August board meeting. We also currently have a public member position available or open. And then in terms of the PFAC, we have one physician member who we're currently seeking fulfillment for. I've worked with Nicole Krishnaswamy, Executive Director of the Oregon Medical Board, to have this position sent out to all the physicians on their listserv. And we also ask that board members assist in our recruitment efforts by sharing this information with your friends and colleagues. To learn more about these open positions or to apply via Workday, visit the opportunities page on our website. Chen, I'll turn it back over to you.
So, guess the board election process. That you were gonna do that, good sir.
Happy to do that.
You.
Indeed, that is me.
Here's that,
I'll give you some background and then turn it over to you, President Chin. So each year, the board is directed by ORS 689-185 to elect officers for president and vice president to serve one-year terms. Board members may nominate any board members for each office at the request of the current president. Pursuant to ORS 689-185, Parent 1, the State Board of Pharmacy shall meet at least once every 3 months to transact its business. One such meeting held during each fiscal year of the state shall be designated by rule as the annual meeting and shall be for the purpose of electing officers and for the reorganization of the board. The president may administer oaths in connection with the duties of the board, shall preside at meetings of the board and be responsible for the performance of all duties and functions of the board required or permitted by its chapter, shall have power to call special meetings subject to ORS 689-185 when it may be deemed necessary or upon request of a majority of the members, represent the board to media, the legislature, governor's office, and interested parties as needed. And the vice president, if the president is absent or unable to preside, shall preside, may administer oaths in connection with duties of the board, and may represent the board in absence of the president. Board will nominate and vote on vice president position first, followed by the president position. When the process begins, board members, please raise your hand and verbally nominate a board member. After all nominations are made, voting will be in alphabetical order by last name. The current board president will count the votes, and the nominee with the most votes will be appointed. If there's a tie, a revote for the top two candidates will occur until the tie is broken. Newly appointed board president and vice president terms will begin on July 1st, 2025. President Chin will now call for nominees for vice president.
We'll start accepting nominations for board vice president. If a board member accepts a nomination, each candidate has 1 minute to express their interest in the board, to the board prior to voting. So anybody like to raise their hand to nominate? Yes, board member Joyce.
Board Member Joyce, I'd like to nominate for Vice President Priyal Patel.
Any other? I'd like to nominate Amy Kirkbride for vice president. Any others?
Member Hall. I'd like to nominate Victoria Kroger.
Any others? Okay, then
I would like to nominate Board Member Hall.
okay.
Was that board member Pinedo? Sorry.
Okay, so before we go through the process of voting, are each of these individuals wanting to accept the role as vice president? Because I know that last time that there were people who had declined. So Priyal, is that something that you would like to go through the vote with?
Sure.
Okay, board member Gertrude?
I accept the nomination.
Okay, board member Kroger?
I decline the nomination.
Okay. And board member Hall?
I decline.
Well, it's an honor to be offered. And so, but I thought it was important to be able to give you an option of accepting or declining. All right, so, based on, so we said the last thing, it's the first, in order, alphabetical order, last name. So we will first vote on board member Kirkbride. Is there a motion to move to elect board member Kirkbride as board vice president?
Kroger has a question.
Board Member Kroger, I thought each candidate had some time to say something about
Thank you.
themselves.
You mean that when they're done? Okay, Board Member Kirkbride.
Just for, procedural, and I don't care either way, but is this a situation where the other candidate steps out or? Okay. So thank you for the nomination. I'm happy to be nominated. I, do have an experience, with the formulary committee, as previous chair, so I do see myself as future president of the Board of Pharmacy. So taking on the vice president role, I feel would give me a lead in on experience to learning a bit more about leading the meetings, setting the agendas, getting some experience in preparing for that role. I also see myself as a good support to the president and executive director. And I am well versed in Robert's Rules of Order and running meetings. I feel like I'm a good asset to the president in that regard. I have long been happy to serve in that capacity and, very happy to serve in a leadership role. So I appreciate the nomination and would appreciate your support in the election.
Thank you. And Board Member Patel.
Board Member Patel, thank you so much for nomination. I did not expect that, and I did not prepare my speech. Thank you, and I would say me as a vice president, you will get more fairness, transparency, equity. That's what I'll bring on the table. I do have a lot of experience, like, I'm a business owner. I started the program in the ambulatory care. I have other, alphabets behind my names too, so I'm not really good in telling about myself, but you guys know me more than 2 years, so that's me. Thank you.
Thank you. So we'll start with, is there a motion to move to elect Board Member Kirkbride as the board vice president?
The move, Vice President Joyce.
Is there a second?
Second, Board Member Pinero.
Thank you. Board Member Chin, yes. Board Member Joyce?
Can't vote for two candidates. I vote for Priya Patel.
We'll do that next time. So oppose. That's
I oppose.
So Board Member Beeman? Yes. Board Member Hall? Opposed. Board Member Kirkbride?
Yes.
Board Member Kroger?
Board Member Kroger, yes.
Board Member Patel? Yes. Board Member Pinedo? Yes. Okay. And I think we need to do a second motion.
Yeah, well, because you said the way that it's written here is that you said whoever got the most votes.
So let's do a proposed motion to elect Board Member Patel as the board vice president.
So move, Board Member Beeman.
Seconded, Vice President Joyce.
Board President Chin is opposed. Board Vice President Joyce.
This is a vote to support President Kirkbride. Yes.
No.
Patel, I'm sorry. Yes. That's why I wanted to vote for both. Okay.
Board Member Beeman. Member Hall.
Yes.
Member Kirkbride.
Opposed, sorry.
Member Kroger.
Yes.
Board Member Patel. Yes. Board Member Pinedo. No. Okay, well, we have a.
Wait. Can you revote?
Did Shannon?
You saying point of order, some clarification from Board Member Pineda.
Sure.
Patel for the motion.
Okay, so I said no, because I already said yes, right? This is way too.
Yeah, I think.
What is the vote count?
Yes or no sheet? Yeah.
What was the question?
So the motion was for board member Patel to be vice president. It was, motion by Beaman, seconded by Joyce. And, no, there were 3 opposed to, board member Patel and 2 opposed to board member Kirkbride. So board member Kirkbride is our new vice president.
Well, unless you guys don't think that that was, you didn't understand what you were voting for.
No, I did.
Okay,
I didn't make sure I didn't say yes twice.
yeah.
Yeah.
I mean, you can, it was 2 separate motions.
Yeah, that's why. It's confusing.
It's, like, I think the process of like how this is done can be, it is really confusing.
This is board member Patel, but process is, I was like, this is my 3rd term, and every time the process is different. So how we are going to do this time? And I was like, I wish like there's some consistency in that.
The first time that I was involved, this is how we did it, and the second time when you were here, that was how we did it. The 3rd time was when Director Fox was here and we did it differently, and so, last year was the big different one.
Executive Director Runyon, I did get feedback that whatever happened last year, we did not want to happen again. So I apologize for the inconsistency. It was just based on feedback I got. I was trying to avoid that, so.
Board member Patel, I'm not saying which one is right or wrong. What I'm saying is just different every time. So don't feel bad. Like even I still I get confused. Like, so what I'm voting and what actually I want.
Okay, so. Yeah, we can move on to board president now. Does everybody feel comfortable with this process? I do. Okay, are we comfortable with the outcome of the process with board member Kirkbride accepting and getting voted as the nominee for vice president? I will now accept nominations for board president. Again, if a board member accepts the nomination, each candidate has a minute, and I will remember you get a whole minute to express your interest in the board prior to voting. So nominations?
I nominate board member Patel.
Wait, who, Pinedo?
Can I do that? Oh, sorry,
yes,
board member Pinedo.
Thank you.
Nomination.
Board member Kirkbride, I nominate board member Joyce.
The nominations? By last name, board member Joyce, you have your minute.
So this board member choice, this is my 2nd term on the board. I have the experience on the board to understand the rhythm of action, so to speak. Now, coming up, we have a new executive director, we have our strategic plan, and I want to be able to work closely with the executive director to make sure we're going in the right direction, to make sure we're addressing our priorities, because it takes a lot of time, as you know, from an idea or a concept to rule. And sometimes there's a lack of transparency. I want to make sure there's transparency there, because sometimes things seem to be thrown at us and all of a sudden it's rule and it feels like you didn't get a chance to really state what you wanted to say or express your feelings, as you could tell recently about my feelings towards the most recent budget and the way it was done. Also, as president, I will be leaning very much on vice president to be Amy Kirkbride, especially with her experience and with vaccines. And what's happening now on the federal level, there's a lot of turmoil there. And so she is numero uno when it comes to vaccine knowledge. And so, when it comes to those topics, I will be leaning heavily on Vice President Kirkbride. My experience in pharmacy has been since the 90s. I'm very, very, familiar with how the state of Oregon, or the direction of the state of Oregon as far as where we want to go. But it's ever changing, and we want to make sure that everyone gets their opinion in as a board member and based on their experience. And I do love the diversity that we have here on the board because we all come from different areas. And I look forward to serving as president based on that.
Board Member Patel.
I know, Board Member Patel, I did not expect that today, but thank you guys for nominating for at least vice president and the president. As I said, I was not prepared for any of the speech. I did not even think about it, but I would just bring the fairness, transparency, equity. That's what I'll bring on the table. And I have lots of leadership experience. You can see on the board websites. Thank you.
So is there a motion to move to elect Board Member Joyce as the Vice President?
So moved, Board Member Kroger.
Second, Board Member Hall. Member Chen. Yes. Board Vice President Joyce.
Yes.
Board Member Beeman. Yes. Board Member Hall.
Yes.
Board Member Kirkbride.
Yes.
Board Member Kroger.
Yes.
Board Member Patel.
Yes.
Board Member Pineda.
Yes.
Let's do a,
President Chin, could you pull your microphone closer, please? Thank you.
sorry,
That's okay.
I'm all relaxed. It's Friday. So for the record, this was all yeses for all board members. Is there a motion to move to elect Board Member Patel?
Member Beeman, so moved.
Second, Board Member Pineda.
Board President Chin opposed, Board Vice President Joyce,
Both.
Member Beeman,
Yes.
Member Hall,
Yes.
Board Member Kirkbride, opposed, Member Croker,
Yes.
Member Patel, Member Pinedo.
Yes.
Okay, well, thank you all for the nominations and congratulations to Board Member Joyce. You are elected as board, the board president for the coming year. And now we will recognize Board Member Shannon Beeman. Shannon Beeman. You stand up. Shannon Beeman was appointed to the Oregon Board of Pharmacy on 7/1/2017 before chaos happened by Governor Brown and reappointed on 7/1/2021 and served as the board vice president from 7/19 to 7/20 and as the board president from 7/20 to 7/20/21. For the past 8 years, Shannon's dedication and unwavering commitment to the practice of pharmacy and patient safety have been remarkable. During her reappointment process, when asked why she wanted to continue to serve on the board, she stated that her service has expanded her view of the practice of pharmacy and patient care. We commend Shannon for her commitment to improving access to quality pharmacy care and dedication to patient safety for all Oregonians. Shannon's extensive knowledge and remarkable leadership have been instrumental in achieving the board's strategic goals. When faced with adversity during her presidency in 2020 due to COVID-19, Shannon preserved as and was able to navigate and lead the board during one of the most challenging times in our history. Some of your major accomplishments during your tenure, the Public Health and Pharmacy Formulary Advisory Committee was created, implementing legislative directives and OARs to improve equity of pharmacy services, such as the original PFAC OARs, 16 protocols, 20 vaccine protocols, and the formulary compendium. Prescription reader accessibility and limited English language proficiency and labels in the rules. One of my favorites. Emergency insulin and naloxone rules, telework rules, COVID-19 public health emergency, cultural competency and pain management CE, remote dispensing site pharmacy, pharmacy prescription lockers, pharmacy prescription kiosks, participated in 3 executive directory. Third.
Oh, I think it's 4.
Rules Advisory Committee work groups. There were prescription labeling, accessibility rules, technician rules, safe pharmacy practice conditions, collaborative drug therapy management, clinical pharmacy agreements, and compounding rules. You attended rulemaking hearings once to twice per year in the last 8 years. During Shannon's tenure, the board adopted 269 permanent rules, amended 336 existing rules, adopted 14 temporary rules, and repealed 147 rules, not including rules adopted earlier during this meeting.
That's good.
Shannon's insightful contributions to both discussions and decisions have been innovative and instrumental in our progress. Her presence on the board will be missed, and we wish her all the best in the next chapter. On behalf of the board and agency staff, thank you for your dedication, service to the board and the citizens of Oregon. Shannon, your beaming light, your heart, your ability to give history and bring us back to realities will be missed strongly by all of us, but especially by me. You're passionate.
Thank you.
Oh, yeah.
You're not gonna do this, you guys, on top of it.
When someone cries in the room, I'm gonna cry.
Oh, you're a special prior. Yeah.
Executive Director Reagan. He's still looking for her photo, right?
Or something director.
Or something an onion.
Sure.
Okay. Is light over there? You have flash.
We're plans today too.
I think it's okay because of the back.
That's. Because it failed.
Yeah, that's the interim. Oh, there you go. Okay, I don't think we need to break it. Let's go on to, gonna now review and discuss council appointments, starting with staff member Melvin and mailing D as in the dog.
Okay, in just a moment. All right, staff member Melvin, we'll start with mailing D, and I probably don't need to open the others, but also tied to this would be the applicants would be mailing DA and D little b. So on May 7th, 2025, we sent out a recruitment for volunteer opportunities for the Council on Naturopathic Physicians Formulary and the Rural Health Coordinating Council. In 2023, the board appointed 2 pharmacists for a 2-year term to the Council on Naturopathic Physicians Formulary. Their terms are expiring, so it is necessary for the board to consider appointing or reappointing 2 licensed pharmacists to this council. And the applicants that we received, again, mailing D little a is applicant for reappointment, pharmacist Natalie Gustafson, and mailing DB is applicant for appointment, pharmacist John C. Myers. Also in 2023, the board appointed 1 pharmacist for a 2-year term to the Rural Health Coordinating Council. And today the board will consider appointing 1 licensed pharmacist to this council. Mailing D1 little a is applicant for appointment, pharmacist Yuna Ku, And mailing D1B as applicant for appointment, pharmacist Richard Silverman. Back to President Chin for board discussion.
Any discussion regarding the nomination process or the positions on the naturopathic positions formulary or the rural health coordinating council?
Board Member Kirkbride, I have one procedural question. And I'm not asking for disclosure of any status, but does the staff review pharmacist in good standing as part of the process? So like disciplinary actions, is that considered as part of the application process?
I'm going, Stefan Relvin, I'm going to ask legal counsel if she could weigh in on that. I'm not prepared to answer that.
Correct. Yes.
Do you guys look it up?
In many organizations, when you're considering an appointments, there's a in good standing factor, and I'm just curious if that plays in here.
It should. I don't know that we've had candidates who were not in good standing, but I don't think that.
Executive director running, I'll defer to board council Hunt. If it's an option, I believe we should.
I mean, so like most statutes say like in good, they say it in good standing, and I think that it's okay for it to be an assumption. This is not our stat.
685, yeah.
I mean, I would think it's definitely permissible. I don't know why we wouldn't.
So this is my question about what in the definition of in good standing is. So previous discipline can be, you can still be in good standing with previous discipline.
Right, so typically what in good standing is like, not suspended, revoked. It's still you can still have like, a CPP failure or something like that. Typically, it's just making sure that the license is active and in good standing.
So then there hasn't been any history of being revoked or suspended or anything like that from us or any other state?
Yes.
I'm hearing it sounds like that process has not been done, that there's not currently a process.
Member Pino, that was a good question because on one of the applicants, it says, please note, we did not add the applicant's discipline to the public meeting. So do you say that entail that they did have discipline?
Okay. I'll say. Staff member Melvin. So before I created the mailings, I used our license lookup tool to provide that information to the board. The board has a mailing.
Any further questions?
Board member Joyce, so these are reappointments, is that right? These are
Only one is
One, okay.
is asking to be reappointed. That would be asking to be petitioning to be for a reappointment. Okay. Any other discussion? Let's start with the naturopathic Council for Naturopathic Physicians. So there would be
Oh, sorry. So we need 2 pharmacists appointed to that council, and the 2 that applied are pharmacist Natalie Gustafson and pharmacist John C. Myers. Okay.
need 2, only 2 applied. So would anybody like to nominate the 2 who have applied?
Nominate pharmacist Natalie Gustafson for reappointment to the Naturopathic Council. My motion, board member Beeman.
Second the motion.
You said, did you say Natalie and John together? Because we have,
Yeah,
we have it built together. Sorry, I thought board president
So
was
is there a
gonna read
motion
it.
to appoint Gustafson and pharmacist Myers to the council on naturopathic physicians formulary for the next 2 years?
So move, board member Beeman.
Thank you.
Seconded board member Joyce.
Thank you. Board President Chin, yes. Board President, Vice President Joyce.
Yes.
Board Member Beeman.
Yes.
Board Member Hall.
Yes.
Board Member Kirkbride.
Staying.
Board Member Kroger.
Yes.
Board Member Patel.
Yes.
Board Member Pinedo.
Yes.
Motion passes with Board Member Kirkbride abstaining. And is there a motion to move? So there's only one person for the, well, coordinating council. Pharmacist Koo and pharmacist Silverman have both, applied to be the appointed person. You want me to, does anybody want to make a,
Board member Beeman, I motion to appoint pharmacist Yuna Ku to the rural health coordinating council
team for the next 2 years?
next 2 years.
This, board member Chen, I second that motion. Board President Chen, yes. Board Vice President Joyce.
Yes.
Board member Beeman.
Yes.
Board member Hall.
Abstain.
Board member Kirkbride.
Abstain.
Member Kroger.
Yes.
Board member Patel.
Patel, yes.
Board member Pineda.
Abstain.
Okay. Do we need to do the other, person who was nominated to do? You just do that one? Okay. So the motion passes with board members Hall, Kirkbride, and Pinedo abstaining. So we have our nominees. Thank you. 2 years from now, you'll do it again. Next, we will continue our general administrative discussion items, starting with mailing E and Executive Director Runyon.
Executive Director running. I'll now briefly give some feedback or background information on the Uniform Multi-State Pharmacy Jurisprudence Examination, or UPJE. Open it up for board discussion after that. Since 2019, the passing rates of many professional credentialing exams have seen a significant decline and oscillation in their passing rates. For example, an ICE study, or Institute for Credentialing Excellence, examined the effects of the COVID-19 pandemic on credentialing exams and revealed that 46% of credentialing programs saw a decline in their passing rates from 2019 to 2020. The following year, 66% of programs saw a decline. Of course, the NAPLEX was no exception to this. First-time pass rates for the NAPLEX declined 7% from 2019 to 2022, with more than a third of schools experiencing a decline of more than 10% from 2019 to 2022. In recent years, especially as telehealth has become a prevalent method to treat patients, in certain parts of the country experiencing a shortage of pharmacists, pharmacists have needed to adapt to practice in multiple states and jurisdictions, requiring them to obtain licensure in multiple jurisdictions and pass the MPJE in each. To address this issue and help the boards of pharmacy further streamline licensure, NABP developed a uniform version of the MPJE as an additional tool that boards can use to leverage and assess candidates' knowledge of pharmacy law. It will focus on assessing knowledge of pharmacy laws and regulations that are applicable across participating jurisdictions. The UPJE is expected to launch in June 2026. NABP will maintain an open dialogue with boards of pharmacy throughout, the development process, ensuring that the exam meets their needs. It will be offered alongside the traditional state-specific MPJE, allowing states to determine what best fits their needs. Pharmacists who pass the UPJE will still be held responsible for adhering to state-specific laws wherever they practice, even if they're not addressed on the UPJE exam. State boards, of course, retain the authority to grant licensure and enact rules for compliance with their regulations. In summary, the Uniform MPJE is a unique tool that will address the need to allow practice in multiple participating jurisdictions. Students and pharmacists seeking licensure in multiple states must currently sit for and pass each state's specific law exam. In 2026, graduates and pharmacists seeking licensure in states that adopt the Uniform MPJE will only be required to take and pass one law exam, reducing the overall cost, regulatory burden, and time to licensure. President Chin, I turn it back to you for board discussion.
Thank you. Board Executive Director Runyon. Do you want me to do round robin? See if you have any comments? Just want to raise hands. Raise hands, please. Remember Kroger.
Board Member Kroger, question, is there any statutory limitations from our state allowing this? I know that there's some states where it's in statute MPJE and there's some legal gymnastics that those states are taking to allow the UPJE or UMPJE.
So our statute just says that we have to take an exam and you get to decide.
Okay. So in theory, we could allow both the state specific one or sunset that, or we could do one, the other, both. There's,
So I haven't looked at the both. of
Okay.
it, But when I looked at it specifically what, because I have another board where there are specific about what ethics exam they have to
Okay.
take. And I did not see that there was anything that has to be specific, a state specific ethics exam is not required.
Okay.
In our statute.
yeah,
You guys
I,
get to decide.
okay. I mean, I don't know if we're not deciding now. Okay.
No. No, it's, this is just an introduction and discussion. And I'd be interested to know, how much support there is currently on the board for a uniform, exam. I'm not a licensee, but it's something that I would support in terms of, ease of licensing and ease of, people coming into the state, but I would caution about how do we hold people accountable to our specific state rules, which are so different from state to state, which it's not like nursing where nursing is nursing is nursing. And that's part of why there aren't a lot of compacts for advanced practice nurses, because there are so many different rules for different states, so.
Board Member Kroger, just to finish up, I am in favor of, this, which helps with license portability. I think that we have a nice PIC course that I think is something that really kind of is probably more helpful to the licensees in understanding the specific rules, et cetera. I mean, we have it on the books to have it be required for our PICs over the next few years, right? And I think that's almost better than having somebody pass a law exam. I've passed a number of MPJEs in different states myself, and I don't feel like I would be an expert in any one of their state laws just because I passed that exam. But
Understood.
yeah.
Understood.
But license portability, especially under the current state of just in general pharmacists, I think of just pharmacists of, that's out there and graduation rates declining and just the nature of where we're at. I think the UPJE would be something that I think the board should continue to look into and consider.
You light bulb, when you talked about the PIC class, one of the things that we could consider, if I'm still on the board when this all starts having a transfer, is new licensees, whether they're gonna be a PIC or not. Once you have your license, you need to pass the PIC class within 30 days. Something to think about, because you can't, I mean, if there's not a requirement to take the PIC class, And it is that helpful to people who haven't worked in Oregon. That might be something to think about. Any other comments? Go ahead, Board Member Beeman, had your hand up first.
Member Beeman, I like this, I support this, I think rules change really quickly, and so I think that even though you take the MPGA for a state, and then don't work there, but keep your active license active and then go to work there, the rules are gonna change so drastically and so quickly. In the grand scheme of things, I know as we're pushing them through, we don't feel like they change quickly, but just hearing the number of rules passed in my tenure here, there's a lot, and it's not the same. as
COVID had
it
had a big effect on it.
Yeah, so I think that something like this to facilitate licensure, and then the PIT class was exactly my same thought. Was it's a great way for any pharmacist to be refreshed. And I do think too, like just the retention of studying for an exam when you're studying for potentially other exams from other states. I think that taking one uniform and then doing something like the PIT class, the retention of those laws and rules for our specific state is gonna have a little bit more impact.
Board Member Joyce?
Board Member Joyce, yeah, this is definitely something I support. Pharmacy in general is becoming more of an interstate commerce. So when you have licensees from different states and having them, take and pass the uniform MPGAE, and it helps to have that uniformity interstate wise. Also, the data shows that because of declining scores and declining pass rates, some going forward with uniform MPGAE seems to make sense.
Ian, any other comments?
Right, I'll just define my support. I currently manage a team of pharmacists and registered nurses who take care of patients regionally in 2 states. And so the process of multi-state licensure and tracking that and onboarding people and waiting for one of those states who takes a very long time, who's not Oregon, can be very challenging. And so, yeah, this is very welcome and progressive and like
Any others?
Just have Board Member Kroger, one more thing to add. I know it seems like we're generally supportive of the concept. But I think this also helps when it comes to disaster relief. If there is some sort of emergency, when there's support needed, right? And without needing, intervention from the governor's office to allow folks to come help if there was some sort of emergency that was occurring within the state. This speeds up that process that, individuals who have passed that then would be able to get their license much more quickly to be able to support in the state. So just another thought as we kind of go forward on how do we respond to things quickly.
Hearing no other comments, I'd like to move forward with hearing from Executive Director Runyon about the annual board best practice survey mailing.
Executive Director Running. I'll give you a little background information on this. The Oregon legislature has mandated that members of boards and commissions complete an annual self-evaluation to review adherence to recognize governance best practices. The survey will go out in July, close after 2 weeks, and the results will be compiled into a new mailing for the August board meeting. The purpose of the self-evaluation is to assist boards and commissions in developing governance oversight. The self-evaluation is the board's obligation to assess its own actions over the last 12 months of service. It contains 15 yes or no survey questions about executive director expectations and feedback, strategic management, strategic policy development, fiscal oversight, and board management. Additional contextual information will be provided with the survey itself, including the time frame for which the survey spans. The results of the survey will be included in the BOP's annual performance progress report to the legislature later this fall and will be reviewed by the board again during the August 2025 board meeting. BOP survey results will likely be compared to the results from other health regulatory boards. Agency staff have developed the best practices self-assessment guide to assist you in evaluating and responding to the survey. The self-assessment guide will be emailed to you and will provide additional information to demonstrate our adherence to best practices. President Chen, I'll turn it over to you.
My recollection is that this is a calendar year and not a fiscal year. It's from January of 2024 to December of 2024.
Executive Director Runyon, that's correct.
So it's gonna be interesting what our best practice survey shows over the turmoil of that year. But it is not a reflection on our current leadership and where the board is moving forward. But we are required to do it. So please even fill out the forms. Thank you.
Member Hall, I remember doing this last year, I think, and there was some conversation about whether it was anonymous or not, so it's not anonymous, is that correct? Correct.
Any other questions? Okay, then let's see, it's 9:22. We can either take a break now or do one more quickie. We will now review and discuss mailing G regarding OBOP immigration policies with Executive Director Runyon.
Executive Director Runyon, I'll give some background information on this. As you know, or may know, Oregon is a sanctuary state. And it's been a sanctuary state since 1987, meaning its laws prohibit state and local agencies and police from assisting federal authorities with immigration enforcement without a judicial warrant. To strengthen existing sanctuary laws, the Sanctuary Promise Act, or House Bill 3265, was passed in 2021. The act increases safety and protection measures for immigrant communities through increased support, as well as transparency and accountability regarding government interactions with federal immigration authorities. These recommended policies attached were issued by the Attorney General pursuant to ORS 180810 to help public bodies in Oregon understand state and federal laws governing federal immigration enforcement activities. The goal is to provide practical guidance that complies with applicable laws current as of January 2025. Included in these attachments are 6 model policies and a glossary of terms in general. These policies address questions about collecting and maintaining information about citizenship and immigration status, sharing information with federal immigration authorities, practices for documenting encounters with federal immigration authorities, accessing the facility of a public body, addressing student records, and addressing patient records. I will now pass this to Board Counsel Hunt for further discussion.
This is just here for you guys to adopt, if you'd like to, and it's, our office is required to put them together and to send them out to the boards, and the governor's office has requested the boards adopt them.
Okay, do you want a round robin or raise your hands? Yeah, raise hands. So I assume everybody had a chance to read the information in mailing G. Any discussion regarding request to adopt? Then let's do a motion. Is there a motion to move to adopt the Oregon Board of Pharmacy immigration policies as presented?
So moved, Board Member Kroger.
Seconded, Board Member Joyce.
Board Member Chin, yes. Board Member Joyce?
Yes.
Board Member Beeman?
Yes.
Board Member Hall? Yes. Board Member Kirkbride? Yes. Board Member Kroger?
Yes.
Board Member Patel?
Yes.
Board Member Pinedo.
Yes.
Motion passes unanimously. Okay, we're at 9:25. Let's take a 10-minute break. Thank you, everybody.